Every morning, Manchester wakes up to possibility. Thousands of people step into the day carrying plans, responsibilities, and sometimes quiet fears. For many, walking into a dental clinic is one of them. That's where Transform Dental began. Built on a simple belief that dentistry isn't just about teeth, it's about people. Customer care here isn't an afterthought, it's the foundation.
For me, it's all about customer service. And I always tell my staff, I like going on luxury trips. I like spending time in nice hotels, nice holiday resorts. Firstly, because I enjoy it. Secondly, I get to learn from those places how to provide a good customer service. And I always say dentistry is something that all dentists do. We've got so many different thousand dentists in the country that provide the same service as dentistry. They can do it. What we want to do different is customer service from the minute they come in, or from the minute they call the clinic, or interact, whether it's through social media, to the whole journey of treatment and aftercare. We make sure we provide a service which nobody else can really match. Using the advanced technology, we can give better treatment to patients. For example, composite veneers. I've been doing composite veneers for over 12 years now, day in, day out, doing a lot of composite cases, which can be quite time consuming. Since the printed veneers came along, printed veneers are obviously a better material. It's a hybrid material, contains composite and some ceramic. Second, the fact that it can be printed and made ready before the patient attends the appointment. So less time consuming for the patient. It's making a shorter time, better material. Yeah, of course, equipments are expensive. Anything in dentistry is expensive. But these are expensive equipment that we take on and we try and implement the use of them in the clinic, but it's for many reasons, but more importantly, to be able to give a better service to our clients.
I chose Transform Dental because its reputation precedes it. I've seen Transform Dental a lot on social media with a lot of its clientele, such as footballers, professional people. But you've got professional clientele, it's definitely going to be professional service. So overall, great experience. It's great when you get in there. Really comprehensive. Dentist was fantastic, was able to explain everything. I got an x-ray done, got a 3D x-ray done, which is really cool. So I was able to see my teeth on the screen. I was able to get them rotated as well. So that was really helpful as well. You don't really know what the full types of things that can be done to your teeth. So when you actually get like 3D scan on the screen and they can actually explain the different things that they can do to your teeth with the smile, with the color, with the structure, it starts to get you thinking more. And then next time I come, I can have a better idea of what I want to do.
Nurses, what we really look for is somebody who can come in and get molded to transform dental ways of doing things, which is being happy all the time, being presentable, basically looking the part and just being a great team member. For dentists, what we really look for is people, obviously dentists with good clinical skills. They need to be able to do the work. But more importantly, somebody who listens, a good listener, somebody with really good communication skills, somebody who can come in, again, as I said before, embrace Transform Dental model, whether that's giving good service to the patient clinically and also non-clinically, making sure the patients are really looked after. Somebody who's willing to learn, somebody who's willing to embracing dental technology, embracing the new gadgets. Ultimately, somebody who's happy to learn and progress in their career. But what I really look for is somebody who's good with patients, somebody who understands patients, somebody who can communicate well with the patient and understand exactly what it is that they need and deliver exactly that to the patient. Digital dentistry, we've gone past the days of using alginate impressions or silicone impressions to take impressions of teeth, which could have had many issues of not taking the right impression, the good quality impression. In terms of logistic, delivering it to the lab, there may have been issues on transportation, the casting of the impressions. There may have been many issues along the way. Whereas with this digital workflow, using an intraoral scanner, which gives us great dimensional stability, accuracy, we ensure the scans are consistent. And once the scans are taken, it's just a matter of pressing the button for the scan to be sent to our lab or any other labs, which can be done instantly. And then from then on, we use CAD to design smiles, and then we print out using a 3D printer. So the workflow from start to end is very much consistent for all patients. It minimizes risks and issues that could compromise one's treatment. So the patient journey from start to end, completing the treatment, doesn't really end there. Once the patient has had the work completed, whether that's Invisalign, composite veneers, implants, the patient care doesn't finish there. We make sure patients are looked after. Aftercare is very important to us, and we usually follow up. We provide free reviews for patients who have completed the treatment, so they can come back and discuss if they have anything they want to talk about, make changes. I mean, in most cases, they don't want to make any changes, but it's good to come back for us to be able to give them more information about the aftercare, what kind of things they can do or they can't do with the work we've carried out in the mouth. Aftercare will carry on as long as the patient wishes to come back. We're always there for patients, try and help as much as we can as long as they wish to stay with us.